Tonight on America's Hope, we focus on your health, finding better, affordable health care from a personal doctor, as well as a couple of breakthroughs you may not know about. America's Hope starts now. From the NTD Global Headquarters in New York, I'm Kelly Wright, and this is America's Hope. Thank you for joining us this hour, and we do hope that wherever you are, that you're safe and well, taking care of yourself and your family, because you matter. I mean that. And you know what matters? Your health. How do you feel today? Did you have a good day? Or was it a day where you felt, oh, how am I getting out of the bed? How do I function? Do you have those aches and pains and those woes, and you're tired of being sick and tired? Well, tonight we're going to focus on that. We're going to hear from a doctor who has actually gone out of his way to create a system within his medical practice to make sure that health care is, one, affordable. You see, affordable health care is one of the ways that many of us will find a road to being healthy. Because let's face it, some of us get sick and tired and we don't go to the doctor because we can't afford it. We're going to change all that tonight as you hear from one doctor. His name is Dr. Chad Savage. And then there are some medical breakthroughs that doctors are exploring. What about testosterone? Is it good for men, and is it also good for women? Later on in our show, we'll talk to Dr. Mark Richards, who has an interesting take on testosterone, the big T. Let's get started. Dr. Chad Savage is here with us. He founded Your Choice Direct Care to practice primary care, get this, with a clear focus on the patient and their health. I know some of you might be scratching your head saying, does that really happen today? Well, this doctor is here to let you know that he does that. Dr. Chad, thank you for joining us this hour on America's Hope. It's a pleasure to have you on. Talk to me about why.
Pleasure with you, Kelly.
Thank you. Talk to me why you founded this particular company and what you're setting out to do.
Sure. So I'm what's called a direct primary care practice. I'm thankful to say, more than 1,000 or 2,000 practices that are all independent practices that have sprung up in the United States over about the last decade. And I actually was an insurance-based practice for about 12 years prior to just realizing that as things continued to change and worsen and worsen and worsen with more government intervention in my profession, that it was impossible to continue to practice in the era of in the model of like a Marcus Welby under the auspices of a third-party controlled system, meaning government and insurance controlled system. So if I had told my patients if it ever got too bad, I would leave. And I'd love to tell you I had the courage to immediately, abandon, jump ship and go into this model of practice. But I was midlife, I had a family, career, I have a house with a mortgage. So it actually took quite a bit of time before I finally got up the courage to abandon that very lucrative practice and start my own practice under that model of direct primary care, which is basically a membership model. People pay us anywhere from $50 to $80 a month based on age, and we see them as much as they want to be seen. We don't charge them co-pays. It's not subject to a deductible. It includes telemedicine. We get meds, labs, and imaging services at unbelievably discounted rates because we sell them at cost, and the markup in healthcare is just absolutely absurd. So we realized that we could correct the doctor-patient relationship that had been eroded by the current system and also help correct many of the price distortions that have occurred as well.
So you are a doctor who truly believes in doing no harm, because a lot of people are harmed mentally and financially, and they're always, it seems, some patients, look, let's be clear, some people can't afford the medical care, which is what you've just talked about, without worrying about meeting the expenses and the requirements set by insurance companies and Medicare. I mean, it just reeks of a lot of confusion and really a lot of distrust between the patient and the doctor because of this system that steps into the middle and disrupts that patient-doctor relationship. It seems to me that you've broken through that.
Yeah, absolutely. You stated it well. Actually, when referencing the do no harm aspect of the Hippocratic Oath, one of my friends likes to play on basically what you were pointing to is do no harm also includes do no economic harm. And the problem is American healthcare is almost 20% of the gross domestic product, which is absolutely absurd. If you knew that 20 cents of every dollar you made were going to go to healthcare, you'd probably not willingly and voluntarily pay that much, mainly considering the vast majority of your life you're actually healthy. So that price inflation has occurred really in America since the intrusion of the third parties. The bureaucracy that's been injected has not only added just unbelievable costs. We are a $4.5 trillion industry. If we were a nation, American healthcare costs as much as the third largest economy in the world, only surpassed by the United States and China. We actually would spend more in healthcare than the entire gross domestic product of, for example, Germany or Japan, which are other leading economies in the world. So you would think we would get this just unbelievable return for that incredible investment in healthcare, but we don't. We are getting progressively longer and longer wait times to see physicians. So you wait 3 months now to see a doctor for 5 minutes. Whereas before, when we didn't have as much intrusion, you had a more personalized relationship with the doctor. They could see you more promptly, take more time with you. They knew you. That is something that I sacrificed to go to medicine to be able to do, and I knew I couldn't do under that system. And it really, one of my friends has a practice he calls Epiphany Health, and the reason he named it Epiphany was because he had an epiphany when he realized what was wrong with the system. And the epiphany was that how we pay for the system is actually what's corrupted it so badly. When I left my insurance-based practice and created this direct primary care practice, this cash pay practice that's on a monthly membership model, I reduced my operating costs by over 50% by simply not billing insurances anymore. And that means we schedule in 30-minute and 1-hour blocks. We can see patients same day, which is almost unheard of now in the medical community. And reports such as the Milliman report, which was created by the actuaries, actually indicated that not only do people who partake in this model get better care, but it actually saves the system money because they end up being healthier, going to the emergency department less often, and all those downstream costs of hospitalization, surgeries are reduced. And that's not only a cost issue, but that's humans. That's human beings, human suffering that's being averted by getting better quality primary care.
Wow, Chad, I find your conversation and your ethos to be fascinating at the same time, very encouraging and inspirational to many people out there. I can just see patients coming to you in the droves, and people watching this from places outside of your home area, your practice area in Michigan, probably saying, where can I find a doctor like Chad Savage? Is this model that you set causing or provoking more doctors to follow suit?
Absolutely. We have major conferences each year. The DPC Nuts and Bolts Conference, which draws hundreds of doctors in each year. The DPC Summit, which draws in hundreds of doctors each year who are just burned out. There's a suicide crisis within healthcare, which is, you expect that with war veterans. You don't expect that with the humanistic industry, supposedly like medicine, but people are despondent because they sacrifice their lives to do what they consider to be a noble profession, only to graduate, become physicians, and find that it was anything but that. They were becoming glorified DMV workers, just working on an assembly line of patients, not working on the individuals and getting that humanistic aspect of medicine. So when I started in 2015, there were several dozen of us in the nation doing this. Well, as I mentioned, now there's over 2,000 practices that are doing this. They're all independent practices, so none are exactly the same, but they have the shared philosophy, as I mentioned, of a low-cost membership. They don't bill insurance. They work with insurance, so people get confused by that. You can use your insurance and, in fact, should have insurance or coverage of some sort to cover downstream costs should you need hospitalization or surgery. If somebody gets appendicitis, I don't take them into the break room and pull out my little plastic butter knife and try to go to town on them. We obviously send them to the hospital to do it the right way. But for the majority of the care, 80% of the care, primary care can cover and manage most issues.
Hi, everybody. I hope you're enjoying this episode so far of America's Hope. If you'd like to see it in its entirety, just click on the link below. Thanks for watching.